All right, hello, my name is John Brown. I will be showing you how to do the abdominal CCE today, the abdominal examination. Okay, we have a skeleton here in lieu of an practice patient or an actual patient um, because of Corona, but that's okay. So the first thing that you want to do is get into the room and introduce yourself. Make sure that you wash your hands. You need to wash your hands every single time. And then meet the patient. Make sure that you have the right patient and that you're in the right room. And as soon as you get all the information, you can start the abdominal examination. So the first part of the ab examination is to offer them a drape. I've got a little blanket here, and make them lie flat. Now they need to be at 0 degrees for the abdominal examination. And then once you give them the drape, you can pull up or have them pull up the gown. Now for this demonstration, the pillow is going to probably pop out if we open up the gown all the way. So we're just going to pretend like this is the abdominal area. Okay, so we can go ahead and get started. The first thing that we need to do is inspect the patient, inspect the ab area just with our eyes. We're looking for rashes, we're looking for scars, maybe past surgeries like a mass, or maybe there's something bulging out. We need to look at the contour of the abdomen. There's the 5 F's of abdominal distension, and that's fluid, feces, fat, fetus, and flatus, which is gas or air. You can look around the umbilical. You can look for bruising, but if there's any extensive bruising around the umbilicus area, that would be a Cullen's sign. If they have, you can have stretch marks. If they have stretch marks with a bulging belly and really thin legs, that would be an indicator for Cushing's disease and the pink stretch marks. In terms of scars, you could have, if you have a scar in the right upper quadrant, that might be like a cholecystectomy, and the right, if you have a scar in the right lower quadrant, that might be like an appendectomy. It's just good to review scars on the patient, and maybe they forgot a surgery or something, and it'd be good to keep that in their history. So then we have the second part of the abdominal exam, and that's auscultation. So we're just going to auscultate each of the quadrants. And the normal sounds that you should be hearing is just some gurgling and maybe some, I think it's pronounced borborygmi. Borborygmi is just louder gurgling noises. It could just be a sign of hunger, but it could also be a sign of a bowel obstruction. So it's good to at least take note of it. You might also hear like a high-pitched noise, like it probably doesn't sound like a whistle, but it's gives you a good idea of what it might sound like. That would probably be like air or fluid rushing through a part of the bowel, which might also indicate like a partially obstructed bowel. You might hear some hypoactive bowel noises. and that would be like not very regular, far apart, not very loud. That might be hypoactive sounds like that would be indicative of constipation versus hyperactive sounds where they're really close together and they're a little bit louder. That would be more an example of diarrhea or something similar to that. And lastly, for the auscultation part, if you don't hear any bowel sounds at all, keep searching. So you can't write down that the bowel sounds are absent, because if bowel sounds are absent, that would be a medical emergency. So you have to make sure that you're searching for them for at least 5 minutes before you write down that they're absent. Otherwise, they might just be very hypoactive or something. So I'm going to show you, I mean, I'm sure you know what it looks like, but I just want you to see it, what the auscultation looks like. You're just going to go right into the right upper quadrant, right lower quadrant, left lower, left upper. All right. And now we're going to move on to percussion. So I'm sure we've all seen this type of thing. Okay. If you put it on the person's abdomen area, you're either going to get a more of a tympanic sound, which is more voluminous, I guess, volumey, loud, echoey. I don't know how to explain it, but I definitely know the other sound is a dull sound. And a dull sound would be more flat, low volume. So the expected sound for the right upper quadrant is the dull sound when you do a percussive noise. And that's because the liver should be right up there. But in the left upper quadrant, you get a tympanic noise. Obviously, it's just a pillow, but the tympanic noise is because the stomach, if you're doing it over the stomach would be there. If you're getting a dull sound in the left upper quadrant, you might be getting the spleen. That might also be a sign that either the spleen might be enlarged or something, or a little bit out of place. The lower quadrants will both ideally be tympanic noises, so you're going to hear them very well because they're just the small intestines and the large intestines. They have a lumen to them, so they're going to make that tympanic noise. For the liver again, there's something called the liver span test, and basically you're just using percussion to get a good idea of how large the liver is. I believe it's something like 6 to 12 centimeters, so you can note that. And then there's also a CVA tenderness test. So CV is costovertebral angle, I guess. And you'd have the patient sit up and you do the percussive noise on their kidney, basically. And if it's painful to them, then that would be, I guess, a positive sign. This patient doesn't sit up very well, but it's pretty easy. And now we're going to move on to the palpation part. So there's 3 different types of palpations that you're going to do, or 3 different pressures of palpations, really. And that would be light pressure, a moderate pressure, and a deep pressure. And the light pressure is special, I guess, or unique, because you're testing for rigidity or guarding, I guess, and rebound tenderness. So the rigidity And the guarding, that's going to be when you press down and any of the quadrants, they might tighten those abdomen muscles. So the rigidity is due to maybe like inflammation in the area, versus guarding would be, they'd be tightening those ab muscles for protection from the painful stimulus of you rubbing them. It's also important to do it in a circular motion, because if you're stabbing down like this, even in a light way, you might hurt the patient if they have a particularly sore or painful area. And also on the light pressure, you can do a rebound tenderness test. So we're still testing for pain, but you need to make sure you're testing for pain while pressing. Does it hurt while I press? Does it hurt when I take it off? Does it hurt when I press? Does it hurt when I take it off? You can't just press down and press off and say, did that hurt? Each one is a separate movement that you need to know whether or not it hurts. And it's good to mark that down too. And then for the moderate and deep palpations, you're going to want to use a broader hand, I guess. Same thing, circular motions. And you're going to be testing, you're going to be looking for masses or fluid, or if the areas are tender. And if you're doing the deep test, you're probably going to get some amount of tenderness if it's just not a very comfortable feeling to have a lot of pressure on you. And you're just testing each of the quadrants, trying to get a good idea of the organs. And for the last part of the abdominal exam, we're going to be looking at specific organs. And there's a specific way to do this. So for the liver, we're going to take our left hand, we're on the left side of the patient, and we're going to put our left hand under T11 and T12, and then we're going to elevate. Okay, we're going to elevate it. And with our right hand, we're going to go to the mid-clavicular line, and while we're elevating the liver with our left hand, we're going to try and palpate it with our right. Okay? And what you're going to look for is if it's enlarged, or if there's any bumps, if it's painful. Okay? So the next one is the spleen. And we're going to take our left hand and go across. And we're going to push up on at that CVA area. All right? And that's going to help elevate the spleen. And with our right hand again, we're going to go to the costal margin and try and palpate the spleen. Again, we're trying to see if it's enlarged or if there's any bumps. If anything just feels abnormal, you want to look for that. It's the same procedure as the spleen for the kidneys. You're just going to want to lift it up and feel for it. And lastly is the aorta. So the aorta lies just left of the midline, the median line, and we're going to press down and try and feel the pulse for the aorta. Now, if there's a whole bunch of fat down here, you're probably not going to be able to feel it, but at the same time, if you're if you're too far up, you might be feeling the heart. So it's kind of like right in here, try and get under the stomach, I guess. And that would be the abdominal exam. Thank you.